Hi, welcome to What's Happening at Tri-City Medical Center. With us is Dr. Penvose-Yi, a board-certified OB-GYN affiliated with Tri-City Medical Center. Her experience spans both coasts and the Midwest. She is here today to talk about women's health after menopause and managing symptoms. Well, welcome, doctor.
Thank you.
Why is it so hard, or why do women still feel something about talking about their vaginas, and even saying the word vagina, it's almost, it's not a four-letter word even.
Right.
What's that about?
Well, I definitely think there's a generation that just definitely did not talk about it at all. And then nowadays, I just don't know if it's, well, first of all, it's a health issue too. So, and not everybody does a good job taking care of ourselves. We kind of put ourselves, especially women, we put ourselves as last in healthcare. We take care of our kids, we take care of our husband, we take care of the pets in the house, we take care of our job, but we don't even think to take care of ourselves. And so, and then when you talk to people about it, they don't know a lot about it. So either they'll kind of say, well, yeah, that's just the way it is and it's not really that important. Or, you know, I don't really know anything about it, and then it just gets awkward and nobody wants to talk about it. We joke in our office all the time that we love vaginas. So come to Radiance, we want to make sure your whole body's healthy from head to toe, including your vagina.
Yeah, and talking about your vagina and some of the things that accompanied it like discharges and things, and I hear these horror stories, for example, and not just with menopause, but that there's some changes that happens to our bodies that we see even with the discharge, and they're so afraid to.
And who wants to go to an OB-GYN, right? I mean, the joke is, who do you like to see less, your dentist or your OB-GYN doctor, right? So, but so how bad is it that you're going to come and see me about it if it's just not your well exam, right? That's the question. And you know, one of the things with menopausal discharge, it's a discharge because there's an absence of normal healthy tissue there. And a lot of older women will come and think that there's something really wrong with them, that they have an infection. And we really just have to do a lot of teaching that it's not an infection, it's just that the tissues are aging and we need to treat them so they go back to a healthy discharge.
Okay, and can vaginal moisturizers or lubricants, speaking of that, help with that?
So absolutely they can. So there's two typical treatments that we've used for vaginal dryness and getting the flora. It's bacteria, you know, from our mouth down through the out part there, and anything that's the outside of our body, which can even be the inside of our body, has a normal bacteria, normal yeast, and normal flora that lives there, and it has to stay in balance. And as we age, that balance gets lost. And so we can do vaginal estrogens because, of course, when we've been breastfeeding or postpartum or menopausal, we lose that estrogen, and the estrogen is a big, important part of all of our skin, including the tissue in the vagina. And that estrogen helps to bring back elasticity and hydration in the area. For most women, it works, but not for all women. Also, there's over-the-counter lubricants that you can use, the types you have with intercourse, and then there's now vaginal prebiotics and vaginal biotics that we can put in. And again, that helps get the flora back in order, helps get our pH back in order, and hopefully make that a nicer environment. And then finally, a newer treatment, because those treatments aren't always successful, is the vaginal laser to help rejuvenate the tissue in the vagina, to use our own body's natural healing mechanisms to heal that tissue and make it healthy and younger again.
And I know that, well, at least I heard, again, all of this thing, we hear all these things about your vagina and healthcare, and you start Googling things, but I hear things like taking, was it, they find this in yogurt, I don't know if it's lactobacillus.
Right, so the prebiotics or the vaginal probiotics, yes.
Do you find this helpful for women who are peri or menopausal?
So generally, healthy diet is important, but it's been my experience that eating the yogurt isn't going to fix it. I've even heard of people putting yogurt inside.
I've heard of that too.
Yep. So it's not common, but now they sell nice over-the-counter products that have the prebiotics or the probiotics in there, and that they can be inserted vaginally as a gel. And so, and those can be very helpful in some cases. So you always want to do the minimal amount you need to get the greatest success in recovery or rejuvenation for a patient. So for some people, that's all they need. They have the tissues overall, it's held up pretty well for them, and they just need something to maintain it.
And when we speak about vaginal dryness, obviously a woman who is married and has sexual intercourse, it's probably pretty clear that they're not as lubricated as they once were.
Absolutely, and this can seriously affect our relationships. When we're not able to have comfortable intercourse with our partners, that's a big deal, and we're not even always comfortable talking about with our partners, or if our partners know that we're uncomfortable with intercourse, then they feel bad, and that changes the dynamic of the relationship. And if they don't know what to do or don't know where to go, it can cause problems that shouldn't even have to happen.
And the symptoms of vaginal dryness seems to be very clear, but if you're a woman who happens to be celibate and not married,
absolutely.
how would you know that you are, I don't know, suffering from vaginal dryness?
Absolutely. So we can have where our bladder becomes more irritated. You have more often you have bladder infections, or you go to the bathroom more often. Now there's other things that can contribute to those issues as well, but dry vaginal tissue is one of them. If you think about it, our bladder lives above our vagina, lives above our rectum. So if the tissue in here is not healthy and it's dry, the bladder that lives above it gets irritated. And if we don't have that healthy flora down there, the bacteria that live around the opening to the entrance to the bladder the bad bacteria can overgrow and get into the bladder and cause a bladder infection.
Is it, I don't know if the word is safe to say, but if you were going through, if you're having bladder infections, can that be, so you're saying that could
absolutely.
be?
One of the indications for the vaginal laser that we have at our office, the Mona Lisa Touch, is that it can decrease the frequency of bladder infections for some people, and I've seen really nice success in that area.
Okay. And what are bioidentical hormones?
So I'm an ex-chemist, so I think that, I think that hormones are hormones. So there's bioidentical just means it's from more natural sources like plants. They do the same things as hormones that we derive from a more chemical means or isolation from other sources. But some people feel that they're more natural, and I do believe that. There's these receptors we have where the estrogen comes in and hits the receptor, and maybe the bioidentical ones just fit a little bit more and make some people a little more comfortable. So I work with both prescriptive and bioidentical hormones, and indeed some hormones are prescriptive and bioidentical, but they're more natural hormones that people use.
So less chemically involved.
Yes.
But is that still, you still take it like in a form of a pill? How do you administer
most
that?
of the bioidenticals are topical creams or gels. There's one that's a spray. There are pellets that they make. There's some, I don't do the pellets, but some people will do the pellets or little injected pellets that have a delayed release of that hormone.
Okay, and is there a way to prevent menopause symptoms?
Well, there is, and this is a tough one, and everybody deals with this, but healthy diet and exercise is the first line treatment. Of course, none of us want to hear that, including myself. But the healthier, the more natural and healthier our food is, and the more we exercise, and it doesn't have to be really intense exercise, it just has to be regular walking, some regular athletic activity, and in keeping ourselves at a healthy body weight. That will help with the decreasing the menopausal symptoms of the hot flashes, the night sweats, the sex drive, and all of those things. That's the first line treatment. Okay.
Well, thank you, doctor. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.